Good medical morning. This is Watson with an update on varicose veins. Thanks for joining us on World's Greatest Medical. While you watch the video, leave us a comment about your varicose veins, if you have them. How do they affect your life, and how long have you had them? Also, special thanks to the Mayo Clinic for much of this information. Varicose veins are twisted, enlarged veins. Any superficial vein may become varicosed, but the veins most commonly affected are those in your legs. That's because standing and walking upright increases the pressure in the veins of your lower body. For many people, varicose veins and spider veins, a common mild variation of varicose veins, are simply a cosmetic concern. For other people, varicose veins can cause aching pain and discomfort. Sometimes, varicose veins lead to more serious problems. Treatment may involve self-care measures or procedures by your doctor to close or remove veins. On screen, I'll show you some before and after removal pictures, and I'll tell you about the symptoms. Varicose veins may not cause any pain. Signs you have varicose veins include veins that are dark purple or blue in color, veins that appear twisted and bulging. They are often like cords on your legs. When painful signs and symptoms occur, they may include an achy or heavy feeling in your legs, burning, throbbing, muscle cramping, and swelling in your lower legs, worsened pain after sitting or standing for a long time, itching around one or more of your veins, and skin discoloration around a varicose vein. Spider veins are similar to varicose veins, but they're smaller. Spider veins are found closer to the skin's surface and are often red or blue. Spider veins occur on the legs, but can also be found on the face. They vary in size and often look like a spider's web. When to see a doctor. Self-care, such as exercise, elevating your legs, or wearing compression stockings, can help you ease the pain of varicose veins and may prevent them from getting worse. But if you're concerned about how your veins look and feel, and self-care measures haven't stopped your condition from getting worse, see your doctor. There are treatments such as laser or radiotherapy, and for certain cases, endoscopic vein surgery. Your doctor may recommend surgery if your varicose veins cause severe pain, skin problems, or blood clots.